Okay, you guys, I don't know why my camera is doing this. It's turning the whole dang thing horizontal and not vertical. But in any case, I just had a thought, and it was a thought about something I was watching. So as you can see, I'm watching a video from this person I just subscribed to, and his name is Gad Saad, or the pronunciation of his last name might be different, but uh that's what it says. The title is called Cervical Cancer Screening for Trans Women. He has in parentheses the sad truth underscore 950. I don't know what that means. Maybe it's the number of videos he's made up until now. But in any case, I went ahead and subscribe, and you, as you know, I'm going to list the link, put the link in the description of the video for his video. And I just wanted to say a little bit on this. Of course, right away, it's crazy, but I was thinking, not even why do these people want to do this and everything, but my question was for like the cancer screening of cervix. Of course, the those of you who don't know, it's an awful little process where they invert a man's penis and turn it into in balls and turn it into basically an open wound cavity in their pelvic region that they have to keep open by dilating consistently throughout the day. I'm not sure how many times, but it's enough to drive a lot of them to make videos online and talk about how awful the whole process is. It's growing ingrown hairs. It's like getting infected. It's freaking, what do you call it? Pain, the worst pain ever. So much pain that they're vomiting, this and that. The horror stories are on various videos in YouTube. You can go look them up. But in any case, I'm pretty sure to do that cancer screening, they have to use some sort of machine, or they might even just use a speculum. I don't know how they do it for, biological women, so I'm not sure exactly how they do it. But if they use a speculum, whoo, old buddy, because I was thinking about that. I was thinking about, do they actually know, how pap smears are done? Because as you can see, there's some fool over here that's trying to shit on Blair, talking about trans women actually need pap smears. Well, some do. I'm not even going to dignify that video with a watch. I'm not going to spend my time, waste my time to up your little algorithm, because whatever you're going to say is not worth anything. Not worth my time. So I just wanted to say, for a pap smear, even for a biological woman, like any biological women out there that watch my video, you've been for a pap smear. You've been to the doctor for a pap smear, like maybe years back or recently, and you know how that is. I mean, even for a woman, a real woman that's sitting up here spreading her legs at the doctor's office, and they got that cold metal speculum sticking it up there. They might not even be using the largest ones, the medium or the smallest metal steel speculum. They sticking up there to get to the cervix, and you're gonna feel some discomfort. You're gonna feel some cramping. Ain't no damn cramping. That hurts like the devil. Also, they've got that, and it's like you're built to have a baby come out of there and grow in there and come out of there, and you're built to have it clean itself every month without fail. That organ is doing what it's meant to do. You were born and everything is functioning as nature intended. But we have these people who are sick in the mind, and some of them, they're not that crazy. As you know, Blair ain't had no bottom surgery for as far as I know. Blair is in Blair's right mind. um Love Blair. Anyway, there are some people out here who really think, and then there are some companies that are going along with this, putting the money in, the whole song and dance about how um, a lot of companies and businesses and hospitals and blah, blah, blah are giving money and feeding these delusions to go along with this, to ultimately try to get roll these pedos out here and get them out in the public space. But in any case, let's get back to what I was talking about. So I was thinking to myself, like, It's hard enough for biological women to sit up there and have that dang speculum sticking up there, even working, even with that biological organ working as nature intended. Are these people crazy? These men? Are these men? Are they crazy? These trans women, which are biological men, are they crazy? You're going to be, you're already, there are issues already with the dilation. Pain so bad, you're vomiting. So, do you understand what a pap smear would entail? The pain and suffering you would go through having that metal thing stuck up there? It's not even sticking up. You're not even just dilating. You're not even just sticking something up there. You're sticking something up there, and they're going to start widening that damn thing, that damn piece of cold metal up there, and you got that dang cavity, that dang wound that's trying to heal itself and close. It's not dilating, sweetie. It's not just sticking something, just sticking it and keeping it open. It's sticking something up there that's cold and metallic and hard and painful already. And then it's going to be widened slowly and surely. Slowly and surely, it's just going to be widened so they can see what? What are they going to see? That's an honest question. I want to know. What are they going to see up there? Because they ain't going to see no damn cervix. What are they seeing up there? The top of your lower intestine? I don't know. I'm going to actually see if I can find the biological male anatomical male that anatomy thing. God, I don't know what the words are for it right now. Poster, whatever, image, and see if I can add this to the video so we can see exactly what they would be seeing. It's probably just above like the penis and balls area. Like take that and try to flip that over, and then you be able to see. I don't know. I'm thinking it's the lower intestine, to be quite honest. I'm not exactly sure, but it's not good. Okay? All right. If you made it to the end, congratulations. Enjoy your day, whichever part of the day it is for you. Um, uh, and as always, thank you for watching. Love you guys. See you on the next one. That's it. Okay, y'all. I got some here that y'all need to look at because um and this is probably a part two to the video I just did about the cancer, the trans women who need cervical cancer. As you can see, the title says, "As a trans woman, do I need to get screened for cervical cancer?" So this is the link. Gad Saad, YouTuber, had in his description. So this is the link, okay? And I went to it because I was curious, And this is the Canadian Cancer Society, okay? All right. And if you go down, you read, and this is what I think, you guys. I think the first two lines of this entire article right here need to be the only two lines that exist. And I'm going to read it for you. It says, "If you're a trans woman, you may not have given much thought to pap tests and cervical cancer. And if you haven't, that makes a fair amount of sense. After all, in order to get cervical cancer, you need to have a cervix. That is, the organ that connects the vagina to the uterus. That's it. That's it. Go home. Nothing more to see here, folks. That's all, folks. That's all they need, okay? This could have been the article right here. Just this right here. Okay. But of course they're gonna put some more stuff down here. If you're a trans woman and have not had bottom surgery, you aren't at risk for cervical cancer. Goes without saying. If, however, you're a trans woman who has had bottom surgery to create a vagina, vaginoplasty, and possibly a cervix, what? How do you not know if you have a cervix or not? There's a very small risk that you could develop cancer in the tissues of your neo-vagina or neo-cervix. No, the risk depends on the type of surgery you had. I can't see over the buttons that are on my screen. Surgery you had, uh, uh, where am I? Oh, the type of tissue used to create your vagina. What the hell? What are they using? What other types of tissue can you? I don't know. And cervix and your personal health history. What in the hell? But the risk depends on the type of surgery you had. Just leave it at that. Unnecessary surgery. Why you need? Don't get it. Don't get it. It's like basically they're saying that the reason that you may have a chance of developing cancer is because of the surgery. Just say that. Just be honest with your with the people you taking money from. Talk to your healthcare provider to figure out your specific cancer screening needs as part of your overall pelvic health following surgery. Lifetime patience. Lifetime patience. And I didn't even get to read the bottom. I don't think I want to, but let's dive in and see what else craziness they're gonna see. Um, it can be, yeah, it's not that much. Let's go through it. If it can be difficult to make cancer screening a priority, especially when there's not a lot of information out there about cervical cancer risks for trans women. Of course it's not. Of course it's not. You may also be concerned about things like experiencing transphobia during the screening process. Why would you even put that into somebody's mind? Why would you even put that into somebody's mind if you're already out there like saying like, "Oh, come on, trans women, come here to get your pap smears and all that shit." Why would you even put it into somebody's mind that you should be scared? You should be. They're basically saying like, be scared, be afraid, be very afraid everywhere you go. Here, if you weren't thinking about fear, here's more fear for you to think about. Okay, like maybe you feel you have more pressing health concerns, yeah, in your mental state, or maybe you just don't want to think about cancer screening. I mean, still, it's important to take care of your health by getting the cancer screening you need. You're sure going to need some cancer screening for that wound, for that gaping hole that you need to dilate. Screening means checking for cancer before there are any symptoms. Here's the bottom line: if you're a trans woman who has had bottom surgery, discuss your personal risk for cancer in your neo vagina or neo cervix with your healthcare provider and come up with a plan for cancer screening that works for you. Why do they have to say neo cervix and neo vagina? Why do they have to say that? If it's real, why do they have to say that? Okay. Like I really hope that somebody is in a if I ever am in a hospital or healthcare practitioner's office and somebody come up to me and be like, "Well, I'm a trans woman and I'm going in for some cervical cancer screening." They look a bit nutty. I'm gonna be honest with them. I'm gonna be frank. And if they ask me, any tips on taking a pap smear, I'm gonna be like, "Oh yeah, here's a tip for you. Get the largest metal speculum out of the whole list. You don't want the small one. Get the large one. Get the large one and make sure they open it wide so they can check and see to make sure you really don't have any cancers. They can make sure you don't have a single cancer because you never know. You may have cervical cancer. You may have lung cancer. You may have skin cancer. You never know. So make sure you open it wide, wide, wide so they can see what's inside. Make sure you don't got no cancers. Okay? I think that's it for now. Um, as always, thank you for watching. Love you guys. Have a great rest of your day. See you on the next one. Bye bye. That's it.